Thank you. Let's dive deeper here into what's next. After a week of uncertainty and a lot of frustration that saw teacher sick-outs leading to closed campuses in San Francisco and Oakland. And across the Bay Area, parents are reeling as they question how to best keep their children safe. Joining us now, Dr. Grace Lee, a pediatric infectious disease specialist at Stanford Children's Health, also the chair of the CDC's Advisory Committee on Immunization Practices. Thanks for joining us, Doctor.
Thank you so much for having me.
We have heard it here from the Bay Area across the country. City leaders saying the classroom is the best place for children. Given that some students are still not vaccinated, and of course you can't always ensure children are wearing their masks properly, how safe is the current classroom?
Well, a few things. One, COVID-19 is clearly here to stay, and so we need to learn how to live with COVID-19. We recognize that as a pandemic evolves, we need to adapt and evolve our strategies to address the pandemic as well. I think what we need to focus on is this shared goal of making sure that we keep everyone as safe as possible and recognizing that everything is about trade-offs. We can ensure that we have policies and procedures and processes in place that have shown us we can keep environments safe, including schools, healthcare settings, and communities. And while we can do that, and the role of our health systems, public health experts in schools is to ensure we have those processes in place to create those safe environments, we also rely on individuals to ensure that they know how to do their part and to keep the environment safe.
So we've seen teachers asking for specific things, such as everyone wearing either an N95 or a KN95 mask, not those cloth masks we still see. Teachers also want better air filtration. Are those measures, how effective would those measures be in helping to ensure children's safety?
Well, I think we've had many tools in our toolbox to be able to use to protect our children and our teachers during this pandemic, and they have worked extremely well. What has been amazing is that the transmission hasn't been the highest in school systems. It's really been highest in our communities. And when we're seeing positive cases, it is coming from the communities. So thinking about what strategies we do have, I would say that I certainly think that moving away from cloth masks is an excellent idea, whether you use surgical masks or other masks of different grade. Continuing to maintain our policies around universal masking, making sure all eligible kids are vaccinated actually can have a huge impact. And I think part of the reason we're seeing perhaps a lower severity of Omicron may be partly due to the variant itself, but it certainly is related to the fact that we have a high proportion of people vaccinated in the Bay Area. We still have a lot of work to do in children, and there are many opportunities to add that protection. What I would say is that schools have done a phenomenal job. The other tool I'd emphasize that schools have started to use is thinking about reducing large gatherings, such as school sporting events, over the next couple of weeks. And to me, that's really about using cohorting as a strategy and minimizing the risk of spread in large gatherings. So I think there's many tools we can use to keep the environment safe.
And we have seen some districts talk about, no spectators at indoor sporting events for students, that type of thing. Let's swing back to something you said earlier on in our talk, that we have to learn how to live with COVID. I had some people telling me a little bit about measles in the past, and that people were never tested as often as people are now being tested for COVID. People may have had a mild case of measles but didn't even know it. How do you want us to look at COVID now and in the future?
Well, a few things. So one is I think there has been much greater attention to what we can do to not only protect ourselves, but also those around us. And so one point I want to emphasize is that if your child is symptomatic or if you're symptomatic, whether or not it's COVID, anything you can do to mitigate spread of any viral infection is something that is good for the community. So making sure that whether or not it's COVID and with or without testing, it's incredibly important to do our part to protect others. That's one thing. The other thing is that I think that we're going to have to learn how to make sure that we do our best to maintain the capacity in our workforce, which is critical to keeping schools and healthcare systems open. So very much appreciate that many of our teachers have borne the brunt of this pandemic, as have our healthcare workers. But I also want to just recognize that kids, I think, don't necessarily have a voice in this pandemic. In school, they have been one of the first groups we have leaned on to close in the context of the pandemic. I think we have to learn how to live with COVID-19 in general and find a way to make sure that we can create those safe environments for our kids. They have been greatly impacted by the pandemic, far more perhaps than any of the rest of us. And I think we're still now beginning to just recognize the burden that COVID has had, whether or not they have infection, but the burden that's had on their emotional health and their mental health, as well as their physical health. And I think there's a lot that we can do as family members, as parents, as members of the community to support our kids in a safe learning environment.
It's an important reminder. I know we talked a lot about that sort of when schools were first closing, but that was almost 2 years ago, and we don't hear that message often enough. Dr. Grace Lee, thanks for joining us today.
Thank you.